Hello and welcome to today's webinar, Giving Thanks, a Guide to AuthoraCare Services. This webinar is part of a series called The Power of Knowing, created by AuthoraCare Collective. AuthoraCare was formerly known as Hospice and Palliative Care of Alamance-Caswell and Hospice and Palliative Care of Greensboro. To get us started, please welcome our moderator, Risa Hanau. Risa serves as Director of Education at AuthoraCare Collective and is also a member of the Cone Health Ethics Committee. She is a licensed clinical social worker. Risa, we turn it over to you.
Thank you. Thank you so much. And welcome everyone joining us this afternoon. It's a lovely November day, and this is a perfect day for our Giving Thanks webinar. November is National Hospice and Palliative Care Month. It is also National Caregiver Month. And we know that it is the beginning of the holiday season. I want to welcome our panel so that we can get our conversation started this afternoon. Joining us is Shirley Cates, palliative nurse practitioner with AuthoraCare Collective. She has been with us for more than 2 years. She originally received her bachelor's degree in nursing in 1983, and then in 2010 earned her master's degree in adult and geriatric nurse practitioner from UNCG. She is a wonderful practitioner with our palliative care team. Welcome, Shirley. Also, a nurse practitioner with our palliative care team at AuthoraCare Collective is Kristin Gustler. Kristin started her nursing degree when she earned her bachelor's degree in 1990. She worked both in emergency room and in hospice for many years until she returned in 2008 to receive her nurse practitioner master's degree and has joined AuthoraCare Collective to work with our palliative team. Mary Manley. Mary Manley is our Director of Sales and Marketing here at AuthoraCare Collective, and she is a passionate advocate both for seniors and those who are disenfranchised in our community. She is somebody who wants to ensure that everybody receives the most information about the best services that will be helpful for them to ensure dignified and quality care during their life. Welcome, Mary. And Gayle Scott. Gayle is a licensed clinical social worker, and she has over 25 years in hospice and end-of-life care. Gayle has worked with both campuses of AuthoraCare Collective over the many years. She is a dear colleague and holds a master's degree from Virginia Commonwealth University. She is not only passionate about care of patients as they approach the end of life, but also their family and caregivers. Thank you, Gayle. And we want to know who is with us on our call. We want to know a little bit about you. We know that during this time of COVID, many of us have picked up a few additional roles. Many of us serve many different things, many roles, from being healthcare professionals to being caregivers. So if you would take a moment to complete our survey, it's multiple choice. You can indicate all of the different roles that you are filling. And we know that many of us juggle many things at the same time. So if you would go ahead and click all that apply to you at this time, this is our way of being able to see who's joining us in a virtual way. And I have become increasingly grateful for the use of our virtual platforms. So let's go ahead and see who is joining us. If we go ahead and look at the results of our survey, of our polling question. Give it just a second to get so we have a lot of healthcare professionals joining us. We know that having education about our services and learning about how we can be well equipped to educate others in the community is so important. And not surprisingly, we have a number of caregivers, community members, and human service professionals joining us. Thank you all for being with us. I want to point out during our conversation this afternoon that at any time you can enter a question. There is a question and answer block at the bottom of your Zoom screen, and you can open and type in a question, and we will do our best to answer all of the questions that we receive during our time together. It's also the case that we will be sending an email tomorrow, and that email is going to not only have a recording of our conversation, it will also have resources that we discussed today, and it will have the ability for you to respond and ask a question in case we don't get to answer one that you might have today. So to get our conversation started, we are all members of AuthoraCare Collective. And AuthoraCare Collective, Mary, is an organization that provides many services to many in our community. And you are the person out in our community explaining services, ensuring people have access and understanding to AuthoraCare Collective. So can you just tell us in a broad way about the different services that we provide, how we provide them, and how we've been doing that during COVID?
Thank you, Risa. Yes, as you indicated earlier, November is National Hospice and Palliative Care Month, as well as National Family Caregivers Month. This is a time when we reach out to raise awareness about the highest quality of care for all people who are coping with life-limiting illnesses, and to really highlight how AuthoraCare supports families and patients in health crisis. This year, as we face the greatest threat to our well-being that most of us have seen in this lifetime, we at AuthoraCare are especially mindful and grateful for the work that we do every day, and for the countless families who've entrusted their loved ones into our care. And as we rapidly approach the holiday season, our goal is to ensure that patients and families, find the dignity, respect, and love during this difficult journey, realizing that for many, holidays will be a stark contrast to holidays in the past. Hospice and palliative care have never played a more integral role in the overall continuum of care as they do right now. As a provider of both hospice and palliative care, AuthoraCare Collective helps patients in all phases of their disease process to live as fully as possible despite their diagnosis. I'd like to share an overview of several of the cornerstone services that AuthoraCare does provide. Our palliative care team, first off, is there with patients in the early stages of their illness. This is a specialized form of care that focuses upon educating our patients about their disease, managing their symptoms, helping them to understand and reconcile their medications, honoring patients' goals for their own care, and finally, assisting patients in identifying what's most important to them and helping them to put these wishes into writing. With a written order from a physician, a patient can get started with palliative care at any point along their disease continuum while still seeking aggressive and curative treatments and therapies. Hospice care, of course, is probably the service for which we're most widely known. This is a specialized level of care for our patients who are no longer seeking curative treatments, or treatments are no longer viable, and whose life expectancy is 6 months or less. At this point, patients and their families have opted to focus more on quality of life rather than quantity. Our expert team of hospice professionals is made up of registered nurses, certified nursing assistants, chaplains, licensed social workers, bereavement specialists, nurse practitioners, and medical director. Our team provides the highest level of medical care with the emotional and spiritual support that families need when confronted with a life-limiting or debilitating illness. Patients receive care in the comfort of their own home or wherever they call home. And there are a number of illnesses that may qualify a patient for hospice, including heart failure, kidney failure, COPD, Alzheimer's, Parkinson's, ALS, and of course, cancer. But just note that this is by no means an exhaustive list of potential diagnoses. And of course, our children who are suffering from a serious illness or who may have experienced the loss of a loved one receive comparable support through our Kids Path program. Children and teens ages 14 to 18 benefit from age-appropriate therapeutic tools, support groups, and grief camps designed to help them cope with loss in creative ways. Pediatric home health and hospice are also essential services of Kids Path. And our dedicated Kids Path team takes a team approach to caring for children with life-limiting illnesses, working with their families, their physician to coordinate care and to enhance the quality of life for children and their families. Our staff also provides supportive care to parents who are expecting a baby with a life-threatening condition. Illness and subsequent loss of someone we love naturally results in grief. And although the grieving process is normal, we often need help navigating very complex feelings and emotions. And our trained and licensed bereavement staff meets clients wherever they are emotionally, physically, and spiritually as they negotiate the healing process. And grief can look a number of ways, whether it's through, or grief support, I should say, can look a number of ways, whether it's through one-on-one adult counseling, support groups, and workshops to help participants explore, how they're feeling and to help them navigate the healing process and to rebuild their lives. And then finally, we understand that caregiving is often, isolating, overwhelming, and full of uncertainty. And AuthoraCare Collective travels this journey with our caregivers. Our team helps by providing support, learning opportunities, and access to essential community resources. And of course, with COVID-19 being a very huge factor in our day-to-day lives, it has changed how we're doing all that we do. For the most part, whereas in the past, we've done everything face-to-face, which is our preferred mode of delivery of services, to a large degree, we've gone virtual. So many of the counseling sessions, whether it's adult or children, we've had to go to a virtual platform, much like this one, and some of our patient care as well. So we have learned to be agile and very flexible in this new space.
Wonderful. Thank you. That is a great overview of our services. And again, anyone who has questions, please enter them into that question and answer box. And Kristin, I want to turn to you. You are a part of the palliative care team, and palliative, just that word, is something that not all of us are very familiar with. And if you could tell us a little bit more, go a little bit deeper than Mary did in her overview. Tell us about our palliative care program at AuthoraCare, who it's appropriate for, and when I might start considering whether for myself or a loved one that palliative care services might be helpful.
Thank you, Risa. Our palliative care team is specialized with our medical staff of doctors and nurse practitioners, and we focus on providing relief from symptoms and stress of serious illness. And how we do that is we work with the patient's family physician, primary care, and we provide an extra layer of support. Our goal is to improve the quality of life, and the palliative team does this by relieving symptoms and distress. We help the patient and family better understand the disease processes and diagnosis. We help to clarify goals and treatment options. We also assist in decision-making, advance directives, and coordinate with their doctors and specialists to have the optimal outcome for the patient's choice. And for what to expect from palliative care, that we will provide constant communication with the patient and families. We have good outcomes with more open communication and to advocate for what their wishes and needs are. We also help with relief from symptoms such as pain, shortness of breath, fatigue, loss of appetite, and will help carry on daily life to improve ability to go through the medical treatments. Palliative care will help match goals to the treatment choices, and the palliative care team can be added at any serious illness at any stage that impacts daily living or alters one's life. Most insurances do cover palliative care visits. We see patients in the long-term care facilities, short-term rehab, in addition to homes. We often see patients after hospitalizations to help bridge those resources when a person's trying in the process of the initial decision making, but we also do it in chronic disease management. We don't replace their primary care physicians, but like I shared, we add to a layer of care. And everyone can benefit from palliative care, including caregivers and patients. They are the special focus of palliative care, and that's the primary reason why we do what we do.
Wonderful. Thank you. It is so true that our palliative program is oftentimes an entry point for patients who are struggling with progressive illness and their families, caregivers. Shirley, we know that for some of our palliative patients, they may become hospice patients at some point, and other patients enter our hospice program directly into it. And I wonder if you could talk to us some about hospice in particular. How is hospice different than palliative care? And who might be eligible for hospice services?
Thank you, Risa. As Mary and Kristin have stated, we deal with a lot of patients and their families that have life-limiting or acute and chronic illnesses. When someone has had an illness that really is limiting their life to where two physicians agree that their potential prognosis is 6 months or less if the disease process continues on a natural course, then that patient is eligible to receive hospice care. And that means that, yes, they are focusing more on the best quality they can have for the remainder of their life. Either the treatment process for the disease is either not working anymore or causing more undesired side effects versus desired effects, managing the disease process, or if the patient just decides that, well, no, I don't want to do dialysis anymore. I don't want my chemo or radiation any longer. I would just rather live, more naturally without any outside and elevated procedures or medications. And so the focus then is on comfort and quality and spiritual and social comfort as well for the patient and their caregiver if they have one. And it can be provided within the home or assisted living or nursing facilities. So sometimes when we have persons admitted under the hospice wing, which is you have a team of caregivers, as Mary mentioned, you have an RN, a nurse's aide, we have a social worker, a chaplain, we have veteran volunteers. And, since COVID began, our in-person visits have changed, but we are still able to help in caring for the patient and their caregiver. And it also helps to provide some of the equipment that they need as that patient is becoming in a weaker state as they approach end of life. So some persons may be admitted if they have an additional decline of their health. A family member can request being evaluated for hospice. They might talk to their primary care or their specialist. That person may be having an acute illness and they go to the hospital, and in talking with the patient if possible or their caregiver or family, they decide that, well, we don't want to have aggressive treatment anymore. And so there is also inpatient palliative team. They're not part of us, but we work in conjunction with them that can initiate an evaluation and decide that, well, maybe this patient is eligible for hospice at this time, and decide upon if they're able to be discharged from the hospital, either go home or to a facility or to an inpatient hospice unit. So that's another way. A patient can already be receiving palliative services like Kristin mentioned, and after the discussions and meetings and visits that we, the palliative nurse practitioners, have had, and we're seeing that that patient is declining, and we again have those discussions, those hard discussions that we need to have, and act on that plan. Well, maybe it's time, and yes, their life is limited more, and they're just not doing well, and it's more of a opportunity to have that person have a choice, have a voice about how I want to live out the remainder of my life, whether it's spoken and planned prior to, or if it's now time for the family to make that decision for them in their best interest. So the hospice team is a great team. They're there for the patient and the caregiver. They have 24-hour nursing availability by phone, and then the hospice nurse will make that decision if they need to make an in-person visit. So it can be an ongoing thing. And, there are times when a patient receives that good, supportive, quality one-on-one care, they improve and they get kicked out of hospice. But, everybody is an individual, and we just have to go with that and treat them as we need to.
Great, thank you. We know that patients in our palliative program, patients in our hospice program are rarely journeying alone. We know that, Gayle, so often there is that caregiver by the side, and that caregiver may be doing anything from running errands, managing finances, up to and including hands-on care, sometimes for short periods of time and sometimes for very long periods of time. And I wonder if you could talk to us about the impact of being a caregiver. And we often focus on the person who is ill, and we want to be sure to shine that light on the caregiver and the support and the experience of being a caregiver.
Thank you, Risa. I am thankful to have this opportunity to talk with you all today about caregiving. Caring for a loved one can be one of the most difficult and challenging experiences, and also one of the most rewarding. Over the years, I have heard many caregivers speak to this experience as being a gift. They have shared that in caring for another, they discovered inner strengths that they didn't even know that they had. However, caring for another with chronic or terminal illness is hard, especially when for many the role of caregiver is one of many roles he or she fill within a family. Some estimate that 90% of caregivers are family members, and nearly 60% work outside of the home in addition to caregiving, which lends itself to a person or caregiver just juggling so many different roles. The impact of the coronavirus has only magnified many of the issues for caregivers. There may be increased financial hardship related to COVID, care for and remote learning for school-age children. Many caregivers are reporting increased levels of stress, anxiety, fear, and guilt. While many resources and services have been suspended or provided in different ways, they are still available, As Mary, Kristin, Shirley, as we've all shared, AuthoraCare is still providing hospice, palliative care, grief services. Also, I know locally our Meals on Wheels program, while the meal delivery is a little different, rather than delivering a meal daily, they're delivering weekly frozen meals. They are still providing services, as are many other community resources. Support groups that previously met in person are now meeting virtually, and some community agencies are providing check-in by telephone. Add to this the upcoming holidays. While the planning and preparing for the holidays can bring its own added stress, it is also a time that many caregivers have come to rely on more family being around to help with caregiving or to provide additional and necessary support to caregivers. Due to recommendations to eliminate travel or have small gatherings, families are having to find creative ways to connect via Zoom, FaceTime, by phone, which is supportive, but it's not the same level of relief or respite that many caregivers look forward to when family is around. The emotional and physical demands of caregiving can strain even the most resilient person, which is why it is so important to take advantage of any and all resources and tools available to you as a caregiver. That is a lot easier said than done, as it is my experience that most caregivers have a hard time asking for help. Often caregivers are so focused on their loved one that they don't always recognize that their own health and well-being are suffering. It is important to be aware of signs of caregiver fatigue or burnout, such as feeling overwhelmed or constantly worried, feeling tired most of or all of the time, getting too much or not enough sleep, change in eating patterns or gaining or losing too much weight, becoming more easily irritated, frustrated, or angry, just losing patience, overwhelming feelings of sadness, physical problems such as headaches or stomach aches or just pains, and using alcohol or drugs to cope. It sounds so cliche, but it is important to remember that if you don't take care of yourself, you will not be able to care for anyone else. That is why it is important to have some ways to care for yourself as a caregiver. Accept help. As I mentioned, caregivers often have such a difficult time asking for or accepting help from others. But accept help and be prepared when someone asks what they can do for you. It's very common that someone will say, well, let me know if there's anything I can do for you, or how can I help you? Have a list. Think about ways that others may be able to lend a hand, whether it be picking up a prescription, some groceries, running an errand. And when someone offers, be prepared to say, well, I have these needs, and let the person offering choose what might be easiest for them to manage. Focus on what you can do. It is normal to feel guilty sometimes, but understand that there is not a perfect caregiver. Believe that you are doing the best you can at any given time, and that when you are feeling overwhelmed with decision making, remember you are often making just the best decisions you can with the information that you have at any given time. As much as possible, put together a strong care team of family, friends, church members, and professionals to support you and to walk with you along the caregiving journey. Establish a daily routine and break down large tasks into small steps. Get and stay connected. Find out what caregiver resources are available in your community. If your loved one is already under the care of AuthoraCare Hospice or AuthoraCare Palliative Care Program, the assigned social worker to your team is an excellent resource, and or review the links and resources that we'll be providing at the end of this program and in a follow-up email. Also, the local senior centers, the area agencies on aging are great resources, as well as sometimes just Googling caregiver resources or looking at disease-specific websites, the American Cancer Society, the Alzheimer's Association. Those disease-specific websites can also give a listing of support groups that may be in your area for those caring for individuals, for example, with dementia. Join a support group. As we've mentioned, many support groups that previously met in person are being held virtually. A friend and colleague shared with me recently that her participation in a support group for caregivers of individuals with dementia, her mother was diagnosed with dementia, and she was her primary caregiver for many years. And she shared with me that this support group for caregivers of dementia patients was just a real lifesaver to her throughout her journey. Monitor your own health. Develop and maintain healthy eating habits as much as possible. Exercise. Try breathing exercises, mindfulness, prayer, meditation. These are all excellent for reducing the anxiety that often accompanies caregiving. And if you're having physical symptoms or just in general, don't neglect your own health. See your doctor, have annual checkups. Know that you are not alone. Again, asking for and seeking help is easier said than done, but it can make the biggest difference. And remember that old cliche we discussed before, you cannot take care of anyone if you don't take care of yourself first. We say it because it is true.
Thank you. Such important words for all of us to hear. I think just even the panel is benefiting from your words. And Shirley, I wonder, Gayle pointed out a number of times accurately how hard it can be to accept help. And you and I had the chance to work together. I as the social worker, you as the nurse practitioner on the palliative care team. And I wonder if you could talk a little bit about how you explain to people the benefit of palliative services starting, accepting that help. How do we explain to people the benefit of having that service? Oh, I think Shirley's having some trouble unmuting. We knew that she was having a little IT trouble. Was that what's going on, Shirley? Yes. Christin, do you want to jump in?
Sure, I'll jump in. I think one of the hardest things with palliative care is when a provider recommends that to a patient, even if it's a chronic disease that they've had for a long time. It can be very confusing because they will say, well, I've had this for 10 years. I've had COPD for 10 years. What's the difference now that I need to have palliative care? A lot of people associate palliative care with hospice, but one of the ways that a provider can explain to their patients and families about palliative care is that it focuses all across the board. Anybody can utilize palliative care, and just reassuring them that this does not mean that you're terminal always, that you're getting ready to pass on, but it is another medical specialty. Just like cardiology specializes in hearts, we specialize in goals of care and advocating for that patient and family and helping with symptom management, that we look at the whole picture. And then we look at what that patient needs as far as the changes that are happening in their lives, whether it's a new change or a change that's been going on for a long time, because chronic disease, even if it's stable, there are changes that happen that impact daily living. So I think one of the biggest ways to help explain the need for palliative care is that they're there to help be an extra set of medical eyes, another medical assessment by a provider to help me or the primary provider in figuring out how else can we help you? How else can we give you the resources that you need? Palliative care has a social worker that's involved. Maybe the patient's not ready towards the 6 months or less for hospice services, but palliative can definitely bring and broaden specialized care to that patient and their family.
Great, thank you. You know, when we think about palliative care, we think about alleviation of suffering, and we know that suffering can come in so many different ways: physical, emotional, spiritual, economic. We know that suffering is something that so many experience, and whether it is through our palliative program, our hospice program, bereavement services, we are all working to alleviate suffering and enhance the quality of life. And Mary, as you speak about our services, we know that people often aren't aware of services. They may be concerned about how they access services. And I know that you are an advocate. You are a guide for people. And can you tell us a little bit about how you even introduce services? Because while we might be gathering virtually for Thanksgiving, this is the time of year sometimes when we connect with relatives and family members and have hard conversations. And how do you help people begin to learn about services and have some of those conversations?
Well, you know, Risa, that's a great part of my role here at AuthoraCare, because of course, most people don't want to have those discussions about death and dying and about terminal illness and just the prospect that we are actually mortal. And so a lot of it comes through education and making people aware that this is the dying process, the everyday navigating healthcare illnesses. That's something that we face, most of us will face at some point. And just helping to empower people to take their own destiny into their own hands. You know, while living with an illness such as cancer, for example, isn't exactly how we would have written out the beginning of our story. We come in and I'm able to have discussions about, you know, let's let you take control of this story. Let's let you as a patient write your own narrative here. And so I think it's important to impress upon patients and their families that they do have choices, and you can live and die on your own terms. And so having those discussions, helping to facilitate those discussions are, you know, very important parts of what I do. And then a lot of it comes also down to educating providers and helping physicians and nurse practitioners who are not savvy and fully knowledgeable about what we do on a hospice and palliative care level, helping them to understand what we do and helping them to develop a sense of comfort in having those conversations as well. And of course, you know, our agency provides support year round, and especially this time of the year, you know, we realize that, you know, providing care and mourning the loss of a loved one is never easy. And so we do provide a number of resources that we make available to patients and families, not only throughout the year, but especially around the holidays as well.
Thank you. I appreciate that. You know, one question that I wanted to bring forward, because I know we hear it often, and I'm sure both Kristin and Shirley and also our hospice staff, where does our primary care physician fit in? Kristin, I know you said that you work very closely with the primary care physician, and that is also the case for our hospice patients. Sometimes family members, patients are concerned that if they work with hospice, that they won't be able to continue to have their primary physician involved. And we bring that primary care physician into our services. And it is also the case that because we have this collective of services, there are patients, we've spoken about patients who may start in our palliative program and then move to our hospice program. But Shirley also mentioned that sometimes patients do improve such that they're not eligible for hospice services any longer. And they might then go to become a palliative patient after being a hospice patient. So we have that flexibility of really assessing what is the most appropriate service for our patients. And I'm not sure, Shirley, if you're able to unmute yet and join our conversation, but just to talk about really, that's a very smooth transition that we're able to make between programs when the time is appropriate, correct?
That's correct. And you spoke about the role of the primary provider, and a lot of times the patient specialist becomes their more regular provider, I'll call it like that. And so they do still have a voice. If that provider still wants to be the patient's attending provider as they are a hospice patient, that is perfectly fine. And a lot of it, it's about communication. It's communicating with the patient and their caregiver, and it's communicating with their provider to say, well, what do we feel like is the best with the patient's input, of course. What is the best path for the patient now? And yes, the primary care, I'm still interested in having a part of what's going on with this patient and being where the nursing staff can then contact me if there needs to be a change of any medications. And they also have our hospice physicians where the nursing staff can contact if there needs to be a change of medications or treatments. The transition does run pretty smoothly. The patients, as we, the nurse practitioners, discuss with our palliative patients, we let the family or the caregiver know, so hey, you still have your primary provider, but you can contact us if you're noticing some changes, some additional decline, and that, well, no, we're not going to go back to the hospital anymore. So we can make those calls. We can do the visits in person as we need to. We can contact the either primary provider or the specialist that is also caring for that patient, and then make and help them in making the referral for the transition to hospice care. And so again, the next team, the hospice team, reaches out to the caregiver or patient, and after it is determined that yes, that this patient is terminal and would benefit from the larger team to help them now as they're having additional decline.
Great, thank you. And Gayle, as we talk about the way that patients move between our programs, we know that there's a large role for our bereavement services. We know that caregivers throughout their loved one's illness are benefiting from the support of our entire team, the social workers, the chaplains, and all of the other disciplines that are involved. I wonder if you could talk to us a little bit as we think about when that caregiver also now is a bereaved loved one, how our bereavement services are able to benefit that caregiver as they continue on with many other roles that they might be serving as they are dealing with the loss of a loved one.
Sure. Yes, so our AuthoraCare Collective has as a part of our service a bereavement care aftercare program for caregivers who have provided care for loved ones who've received our services, as well as members of the community who have experienced loss or grieving. Bereavement services typically begin a few weeks after the death of a loved one. A bereavement counselor will reach out to the identified primary caregiver, offer support and assistance, and set up a plan for further contact, whether that be by phone, in person, or currently virtually, as well as offer support groups that the agency is providing around grief and loss. We also do have retreats and special events around the holidays, recognizing that this particular season of life can be especially difficult for individuals who are grieving. So the bereavement support really is tailored to the individual need of the caregiver and what their what they feel would be most would benefit the most from.
Thank you. And when we think about you spoke earlier about the importance of finding ways to take care of ourselves as caregivers. You made mention of maybe finding some ritual or practice. And I know that there are a range of options for caregivers. And I know that you often help caregivers in terms of identifying what might work for them. And as we begin to think about our time coming to a close this afternoon, I wonder if you could just speak from the perspective of while caregiving is hard, it can also be strengthening. And some of the things that caregivers have shared with you over the years, how they have grown and learned through that process. Because I think those of us in the midst of being a caregiver can benefit from hearing about that.
Sure, I'd be happy to. Well, as I said in the beginning, I've heard many caregivers over the years speak to their role as a caregiver as really being a gift. So many recognize that with education and support and teaching from a care team, such as is provided through AuthoraCare Hospice, they recognize and realize that they have inner strengths that they never knew they had. And in the spirit of giving thanks, I really want to extend appreciation to all of the caregivers, those caring for others. Having worked in the hospice field for many years, I am always astounded by the appreciation shown to hospice staff and healthcare workers for our services. It's not unusual to hear people say how thankful they are for their hospice team, and to even say that the hospice and palliative care services were what pulled them through a difficult season of their lives. They don't know what they would have done without us, caregivers will often say. But I always think of the caregivers who have been with their loved ones providing care oftentimes 24/7 for months, years, sometimes even decades in that caregiving role. And I think about how caregivers are really, truly heroes. I want to reiterate that they're not alone, that there are many programs and services available to caregivers, as we've discussed, in the community, and that they are still available despite the challenges of COVID. Caregiving is, I think, so often one of the most, it's an invaluable resource. We all will be at some point in our life dependent on a caregiver, someone who will be caring for one of us.
Thank you. It is so true that we all need and receive care at different times in our life and need different types of services. Mary, I wonder if you could, when I introduced you, I said that you were a strong advocate, not just for seniors, but those who are underserved often in our community. And we know that both COVID and also the holiday season often brings to light some of those disparities and struggles more than at other times, although we should always be paying attention. And I wonder if you could just share some observations from your work in the community and also some tips or strengthening points for the community to know about resources and that access is available for everyone, although we know some have more struggles than others.
Absolutely, Risa. And fortunately, I think AuthoraCare is very intentional about reaching populations who are disenfranchised or underserved. And of course, as you mentioned, COVID has put a spotlight on those populations who are underserved, and it makes, of course, access that much more challenging. And so in my role and the roles of my colleagues, we try to go where people are. We're trying to tap into markets and communities where a hospice is not so prevalent. And quite frankly, the African American community is one of those populations where there's possibly a lack of trust, a lack of real understanding as to what hospice is and what we do. And two, I think that there's a breakdown between patients and physician communications. And so I always advocate for patients to be their own biggest advocates when it comes to lobbying for what's best for your well-being and for your health specifically. Physicians sometimes have a different perspective on what is best for the patient. Sometimes I think their education and their level of knowledge is more geared toward cure. And we as humans, sometimes it just gets to be too much, and the cure and the treatments become far less pleasant than, just seeking some seeking some comfort care, I suppose I should say. And so, we just try to provide as much education as we possibly can as an organization. And this type of opportunity, learning opportunity, is what we've done throughout this year. And in light of COVID, I do believe that we've reached a pretty significant amount of the population. I mean, being unable to go out into the community has put us at a slight disadvantage, but we've taken this type of platform and maximized its potential, I do believe. And so again, we just ask that, or encourage patients to be their own biggest advocates and seek knowledge and learning opportunities.
Thank you. And we know that while a physician order is necessary to begin our palliative services and our hospice services, anybody can call and start the conversation. We know that people can speak with our staff, making inquiry whether they or their loved one might benefit from our services. And we know that our bereavement services do not require a physician order. That is a service that is available to anyone, whether they made use of hospice services before the death of a loved one or not. As we turn our attention to the holidays, we know that we have an event coming up that we will certainly include in our follow-up email. Mary, can you just share a little bit about some of the gatherings virtually that our community can participate in?
Well, I would love to, Risa. The Light of a Life Service of Remembrance is an event that has been held by AuthoraCare, initially started by Hospice and Palliative Care of Greensboro some 35 years ago. And I am proud to say that I participated for the first time last year, having lost my mother. And it was a phenomenal experience. But this service is an ideal holiday backdrop for honoring and remembering our loved ones. So this year it's being held virtually. Normally we congregate at a local church and just a beautiful sacred service. This year we're having to do it a little bit differently and utilize a virtual platform, but it is being held Sunday, December 5th. It includes beautiful music. There's an inspirational message by a local minister. And then there's a sacred lighting of a candle of remembrance. And so this service, of course, is free and it can be accessed by anyone, whether you've utilized our services or not. And you can go to the website, which is on our screen now, to register.
Thank you. It always helps when you unmute. One of the things I'm thankful for is that little thing that pops up that says you are muted. There are many things for us to give gratitude for. Certainly our excellent panel. You all represent the best of our organization. Our organization is filled with professionals who are empathic and expert in their areas. And thank you for representing the entire staff so beautifully with us this afternoon. I also want to give thanks to those of you who participated. This is a busy week, a hard time, and I appreciate that you were able to gather with us. We'll be sending a follow-up email. We'll include the information about Light Up a Life. We'll also include the link to our website and some other resources that Gayle made mention of. And as we close, I want to share a quote. This is by an author by the name of Melanie Beattie, and it really speaks beautiful to our topic of giving thanks. And it says, gratitude unlocks the fullness of life. It turns what we have into enough and more. It turns denial into acceptance, chaos to order, confusion to clarity. It can turn a meal into a feast, a house into a home, a stranger into a friend. And certainly on this day, at this time, we all can benefit from gratitude and from bringing light into our life at a time that can often feel dark. Thank you for being with us. And I hope that we all have safe days, healthy days, and that we'll all be able to gather soon again. Thank you.